Hi, I'm Caitlin White, and this is the 360 of the room that I will be using. And then this is the instruments and the table, and then I'll be using my checklist. Hi, my name is Caitlin White, and I'll be performing a neurological assessment on you today. This exam helps us assess the function of your brain, spinal cord, and your nerves. We'll be checking your cranial nerves, coordination, muscle strength, and sensation. Do I have consent for this exam today?
Yes, you do.
Are you ready to begin the exam?
Let's start.
Okay. So up first is the cranial nerve 1, where I'll be checking your sense of smell. First, before we start, I would like to check your nasal patency. Can you close one nostril and sniff in for me? And now the other. Great, your nostrils are both equal and patent. Now close your eyes and close one nostril, and I'm gonna hold something under your nose, and I'd like you to tell me what you smell.
Minty. Toothpaste.
Okay. Now the other.
Lotion.
Good. Your sense of smell is intact bilaterally. Next is the optic nerve, which is cranial nerve 2. This is where I'll check your vision. First, we'll do the Rosenbaum chart. So please hold this chart at a comfortable reading distance for you, and then I'll have you cover your left eye and read the smallest line from left to right. Smallest line that you can read.
374258.
Great. Now we'll close one of your eyes.
374258.
Okay. Now the other.
937826.
Great. Now lastly, do it with both of your eyes open and read one of the smallest lines backwards.
628739.
Great. Your visual acuity is 20, 30 OD, OS, and OU with correction. Now we'll check your visual field. Please keep your eyes fixed on mine, and I'm going to wiggle my fingers out from the side, and I want you to tell me when you see them. So look at me.
I see him.
Okay. Tell me when you see them.
I see him.
Good. Okay, your visual fields are full by confrontation. Now I'll check your pupillary response with my light source. I'm going to shine this into your eyes and just look at me. Sorry, I'm going to remove your glasses for a second. Great job. Your pupils are equal, round, and reactive to light and accommodate to near vision. This also tests your cranial nerve 3. Next is cranial nerve 3, 4, and 5. Let's check your eye movements. Please keep your head still and follow my finger with only your eyes. Great, your extraocular movements are intact, conjugate, and no nystagmus. I'll also test the convergence, so I want you to please follow my finger as I bring it towards your nose. Great. Convergence is intact. Next is the cranial nerve 6. For this, I'll check the motor component, so please clench your teeth as I palpate your temporal and masseter muscles. Great, I can feel the strong symmetric contraction of your masseter and temporal muscles. Now please close your eyes and I'll gently touch parts of your face with a cotton wisp. Tell me every time you feel my touch.
Yep. Ooh. Yep.
Sensory sensation to light touch is intact and symmetric in all 3 divisions. Cranial nerve 7 is your facial cranial nerve. Please raise your eyebrows, frown for me, puff out your cheeks, and don't let me push them in. Great. Can you smile? And now close your eyes and don't let me open them. Great. Your facial movements are symmetrical and strong. Next is the acoustic. Next is the cranial nerve 8, and I'm gonna rub my fingers together, and please tell me when you hear the sounds and where they're coming from. I'd like you to close your eyes while I do this.
Left. Right. Both.
Good job. Hearing is grossly intact bilaterally. Next is cranial nerve 9 and 10. Now I'm going to check your gag reflex, voice control, and soft palate. Before this step, I would insert a tongue depressor to initiate a gag, but for the purpose of this video, I'm not going to, and I'm just going to say it's intact. Next, I'm going to have you open your mouth and say ah for me.
Ah.
Say ah.
Ah.
Your gag reflex is intact, your voice is clear, the uvula is midline, and your soft palate rises symmetrically. Next, we're going to do cranial nerve 11. Please shrug your shoulders against my resistance. Now move your head against my hand. Move your head to your side against my hand. Your shoulder shrug and head turn are strong and symmetrical. Next is cranial nerve 12. Please stick your tongue out straight. Great, can you move it to side for me? The tongue is midline with no deviation and moves symmetrically. Now we're going to try your coordination. We'll start with your arms. Can you pat your thighs as quickly as you can, alternating your palms up and down? Now we'll do the point-to-point test. Please touch your nose and touch my finger. Great. Your upper extremity coordination is intact, smooth bilaterally. Now we're going to do your lower extremities. Can you please tap your feet as quickly as you can on the floor for me? Great. Now can you move your left foot up the shin, the heel of your left foot, up your shin of your right leg? Now do the other. Great. Your lower extremity coordination is intact. It's smooth. Now I'd like you to stand and we're going to check your gait. Could you please walk across the room for me? Now back. Now please walk in a straight line with heel to toe. Great. Can you walk back on your toes? Now your heels. Can you hop on one foot? Now the other. Great job. Your gait is normal and your balance is stable. Now we'll check your stance. Can you please stand with your feet together at your side? And now close your eyes. Great. You have a negative Ramenberg sign. For the pronator drift, I'd like you to extend your arms out straight out in front of you with your palms up. Your arms remain in place with no pronator drift. Great. Now we're going to do your test your motor strength using, and I'd like you to, please flex your elbow against my resistance. Here, we'll put it up like this. Flex your elbow against my resistance. Now push against it. Okay. Other arm. Great. Now I'd like you to hold your arms out for me and push up against, and now try to go against me, now try to go against me. Great. Now for your your upper extremity strength is 5 out of 5 and symmetrical bilaterally. Oh, sorry, I forgot. Please squeeze my fingers. Great. Now hold your hands out in front of me and don't let me push your fingers together. Great. Now encircle your thumb and your small finger and don't let me pull them apart. Great. Your upper extremity strength is 5 out of 5 and symmetrical bilaterally. Now we're gonna do your lower extremities. For this, I want you to raise your leg. You can sit down for this. Raise your leg against my resistance. Now this one. Now I want you to open your legs against mine. Now push inwards. And now push your knee. Now this one. Great. Your lower extremities are 5 out of 5 strength and symmetrical. Now we're going to do the sensory chest. I'm going to use the cotton ball for light touch and a sharp dull item for pain sensation. This is what the light touch is going to feel like, and this is what the pain sensation is going to feel like, and the dull touch. I'm going to do this in several different places. You're gonna do your C4. Tell me if it's sharp or dull.
Sharp. Sharp.
And do the inner and outer aspects of the forearm.
Sharp. Sharp. Dull. Dull. Dull.
I'm gonna do your thumbs and your forefinger.
Sharp. Dull. Sharp. Dull. Sharp.
And I'm gonna do both your thighs.
Sharp. Dull.
And then the medial and lateral aspects of your legs.
Sharp. Dull. Sharp. Dull.
And then your fifth toe.
Ooh, that's sharp. That's dull. That's sharp.
Great. Your sensation to, now we're gonna do your light touch. Can you feel that?
Yeah. Ooh, that tickles me. Ooh. I feel it. Oh.
Great. Your sensation to light touch and pain is intact and symmetrical. Now we're going to go on to some special tests. This is the proprioception, and I want you to please close your eyes, and I'm going to move your great toe up and down, and I want you to tell me where it's pointing when I stop.
Down. Up.
Great. Your proprioception is intact bilaterally. Next, I'm going to do your vibratory sensation test. I'm going to place a tuning fork on your big toe and your finger, and I want you to tell me when the vibration starts and when it stops.
You got 1 minute left. I feel it. Yep. Yep. Yep.
Vibration sensation is intact. Next is the discriminative sensation. I want you to close your eyes, and I'm going to place a familiar object into your hand, and I want you to tell me what it is.
Battery.
Can I see the other hand?
Paperclip.
Great. That correct stereogenosis is intact. Now I'm going to draw a number in your hand, and I want you to tell me what it is. Please close your eyes.
9. 5.
Can I see the other hand?
9.
Good job. Correct graphesthesia is intact. Now I'll touch you with 1 or 2 points of your arm, and I want you to tell me if you feel 1 or 2 points.
1, 2, 1.
Great. Correct. 2-point discrimination is intact. Now I'll touch you somewhere on your body, and I want you to tell me where I touched you when you open your eyes.
Knee.
All right, now close your eyes again, and I'm going to touch you on 2 points of your body, and let me tell you. Or tell me where you touched.
Back and leg.
Great. Extinction is not present. Next is the meningeal sign. For this test, I'll have you lay on the table. This will assess the meningeal irritation. You lay down. First, I'm going to flex your neck. I'm watching for involuntary flexation of your hips or your knees. This would be a positive Browinski sign. You have a negative Browinski sign. Now for the Cranial test, I'm going to flex your leg and hip at the knee, and I'm going to extend your knee. Negative Cranial sign. Negative Cranial sign. And finally, I'm going to I'm going to do a straight leg rise. Let me know if you have any shooting pain.
Nope. Nope.
Negative straight leg rise. Finally, please extend your arms out in front of you with your wrist bent like you're stopping traffic. Negative atrixis. Now you can sit on the side of the bed, and we're going to finish this with the deep tendon reflexes. We're going to do your upper body first, and we're going to start with your biceps. Can you hold your arm out? I'm going to place my hand here. Now this one. Now I'm going to do your tricep. Now this tricep. Now I'm going to do your brachial radialis. Great. Great. Your upper extremity DTRs are 2+ and equal bilaterally. Now I'm going to do your lower legs. This is your patellar. And now I'm going to do your Achilles. Great. Your lower extremity DTRs are 2+ and equal bilaterally. Lastly, I'm going to do a cutaneous stimulation. First, I'm going to stroke your abdominal muscles in an X pattern. Sorry. Your abdominal reflex is present, and now I'm going to do your plantar reflex. Your plantar reflex is downgoing with no Babkin sign. This is the conclusion of the neurological examination. Everything appears within normal limits. Do you have any further questions?
I do not.
Thank you.